Sienna 2025. Come and have a unique experience in Dallas, Texas.
Ago na miapete milemiakpe bemiva 32nd annual Sienna Convention Le Dallas Fort Worth. Dallas. Big D. Miva nyapa tepe.
Aha. Sienna 2025. Mano bobo edolo. Miva midwaza. We want me at the Cornwall Friday evening. Sunday me our picnic. Me our church service. And all les zanzazata miniva.
Tata nyo play bofo nyo mi do bonso anamilo. Mi do bonso anami apata mi de kukuna mi be mi pro mi ape famille o valo. Mi pro mi ape famille o mi afa po Dallas da. Mi ado azan. Azalo.
Azase.
Azale kongbe.
Azale wow.
De wonya wodre kuku kleta roji be ya wodo abe lamesedo la ena de nele klalo be ya hohege yi anabe monu popo na su ashiwo be na wodo abe lamesedo la ena ekema monu popo vana obe na toko shida eve pehege na toke yi ana oda serigbale be na tenu awodo le New Jersey le yevu dukome to kwenye be na podokuo de hege na toke yame yiji New Jersey Board of Nursing Dashido ufiala kponu tepo wo le lamese nyawo me akplowo atohege nana yame wafia wo afodo petokewo kle adanu deto yi anabe ntepo kpokpo na asu ashiwo be na wodo le hekame godo le hege nana yama wa anawo monu kpokpo yi awebe natenu adenu yo kata shomnele atome enumake eye le koshida evemegbe a dasedigbanle asu ashiwo be na awodo akodo na oji le apome yinye home health aid meganabe monu kpokpo ya na tonuwo ayiwo to kwenye be na yo kapojeshi yawo hana nkongonglo alo nenyebe ega hiana numekoko bubu Yob 862558464 alo 848-218-1555 atenu aga Yob 773-960-5416 alo na ro email de bccshtrainingschool@gmail.com alo newmanpccsinfo@gmail.com chokaba baganabe monu popo ya na tonu ayi.
Yes, yi KKG akakafo aroji orokogo afuwati agbama biese anyanyi ato jankle makara nanamchi manana nyakoi yenya ba ajikali ikala angama Flo's Tasty Treat anya ajikali ika azena azada shiada akutapeo asroda peo no nyeba na jiga zandum nano gwana ba first course alo starter anya no indudu ika no nyeba na ajiba ya anokoma ye ma ajiba ya dum papi adakwa to ko nyeba na ji Flo's Tasty Treat product here nikanya ashitali ade ya ala nu goma to ko nyeba na akwi de na se baba akwedama o pro pado strong pajio nyano adudum anu na marasiada ji Flo's Tasty Treats anu na sa o kata bala magbuena engagement wedding official fee kana hiania akwaga alaba wono po ta novinga jagaba bo hana grabada wono show na o jumla mo ojire jagaba tashida www.Flo's Tasty Treat yola 212-915-9331 jagaba naji Flo's Tasty Treat na ko agara wo podoma nyano butu Flo's Tasty Treat alagba Flo's Tasty Treat aduna amagbato da shada Flo's Tasty Treat alakpa ayo la gazut jiumo ya hama karan lakana hao Flo's
Yo, hello, Miaweza. This is the Health and Wellness Hub, and Konyenye Miss Dell, and I'm going to be taking you through today's show. I'm going to be hosting today's show as usual. Mr. Akpanamau, Happy New Month to everybody. Today we're going to be talking about diabetes. And in the studios with me, Sienna Ness is Olefi. They're going to help us know all about the Sienna Ness. They're going to help us know about the basics and about diabetes, the basics of diabetes, the little things that we're supposed to know. And the diabetes, the things that the signs and symptoms. And no, the things that you're supposed to be doing. That's what we're going to be doing today. Okay, as usual, me Novi, David, Sarah, LFE, and she's going to be giving us a motivational message for the week and for the day to keep us going. Nyaweka Kazalo, this is the Health and Wellness Hub on Sienna TV media channel on YouTube YouTube channel. Nyaweka Kazalo. Fifia will go over to David Sarah.
Yo, akpekakaka now, Miss Del. Mi hogbelo egbechela mi anovi me gava play nukhla menyao play jidefo nyao. Ye nukhla menya ke play jidefo nya ke jibe ma kovena mi enyebela mi labe na mi adokuyo. Mi labe na mi adokuyo. Elabe shoke jimilela Health and Wellness Hub. Ye eleme ba bela dolele vovovo li ye okbla mo ve vovovo nova de nyame onami kake gbe nyake mi mejibe makove na mi enyi bela mi de nyabo kojio mi avakpo mi abo dokita o. Go for your routine visits and your routine checkups. Eleve viere amedoli ole obo insurance heba health insurance la ole he kake umele koji deo inche meleme ta nuklanu ame nyake me ko gbena mi la menye mi adikato yo inche mele nuklonye dokui bela eleve viere bela mia ade mia kojo awakpo mia bo dokita o no ojuro mia o wo me ple mia la me po lab test ple ke mi opetela eleve viere ye zigede la ne mi yila nyabu bu ochuo meva efimide ye jidele miafo gake jidefo nyake meje machina anyebere dolele de kemeli hi mauma nton adado chonwo ne hobi blasela bibla bela all things are possible. All things are possible with God. Nusia maula ntawo nusianu eye nye dodala ta nyake meje makokpede wenye be never say nya vonde le kojila ji niga delefo gake kwese bela enye a reminder enye enyake mihi mau gbogbo jibe ya chinabela ejebe wo nonome ple wo nududu ple wo na ola netro fiabela lekumile wo capivado gafofo kemila mele wo nyedo ta ejebe ne da afo ta jinami afo dede ta jinami la eye na be minya be okay alame glenami nyama lame mele koko mi jedo eleklele ta ekemila mi chue na subere ole gafofo defo beda mi lenkude miabo nonomenwu mi lenkude miabo nududu on mi lenkude tukada kemio la gbemenami elabe tukada che ple jikuche die dolele alame nami ta egbela mejibe mi bunwere ne mi hwasebela mawu lanton adadonami ne ona machiola maunto ena nunya dalao ye owo amachio atike ona mi be mimi tano na chikola mere kuku na jagbagba na no atikiela mi elabe nele mi ple hosemela e doyoyo ple unse lava asola e dodola egbe machi mikodane elabe edolelie doin ejebe na adogbera ne hweselewo jime bela ne edu amenunyao herbs vegetables and the right amounts of protein plenu kemiola ela ana unseola yes ela be nu kemio chapetela mawu ewe hwese bela ne wo doy leliela eseselekelekechela mawu lanton adadonao mawu lanton adadonao ne hwese azonla jieyi lenkekieme na vagbode me dide me breathe take time within the day and breathe nega fofo de kai alo minute wo alo minute aton alo minute we aton la just get some time 1 minute 5 minutes 10 minutes 15 minutes within the day and just breathe bode me dide me na agbo de me in 4 times alali 4 times 4 seconds kemi ega dasileun 4 seconds just breathe alone mega butame ton dekenwo na agbo just breathe in and out even if it's for just a minute ela akpere won yere ta egbe jide fonya keme cover milo akpe.
All right, thank you so much, Akpena Odabi Sarah. We have to breathe in, we have to take our medications and having the right mindset, no, Akpena Odabi Sarah. Thank you so much. Thank you. At this point, I take a short commercial break, and then I'll come back, introduce Miyako guests to all the studio who are going to help us get more knowledge, know how to prevent or manage diabetes. All right, Akpenami.
Never ever
All right, Nyowe Kazo. This is the Health and Wellness Hub in Konyenya, Mr. My name is Ms. Del. Today we have some beautiful ladies here who are not who are very familiar to us on this channel, who are going to help us to digest and get more knowledge into how to prevent diabetes, or if you have it, know how to manage diabetes. Egbe Davi Fafa, Grace Brown McPaul, LSC, from Sienna Nurses, also Madame Ninette Doche Ajimahe, LFE. They are from Sienna Nurses. Egbe wa vakpere miau obe wa donya onami. They're going to give us knowledge. Knowledge level. Wa vakpere miau egbe. Nemia nya enu ocho diabetes wu no le wu alo nemele wu no la mede wu nemele wu oche nu ke wa explain what you don't have to do so you don't get it too. Ta merekuku mia wezod. This is the Health and Wellness Hub. Mia wezolo. All right, so we'll go straight to the questions. I think my first question would be, what is diabetes? Nembe diabetes. Amedele menya or mesekpo. Even a mesekpo, the person doesn't have really know what diabetes is. What is diabetes?
Okay, diabetes is because we have sugar in our body already, but if it's over the limit, na sugar has to go up woman hour in your sucrito. As to go lay no GG or no na in your sucrito. Ta amasiama abe hafi wa globe sukli dollar nchi wa kefi abe towa ele high level ezu dollar ma menya be na dunuko edu sugar ko edo du do maza mamla na o body per usage gaka nanya be ezu som de buama kazu dolele ta hema o yo na be sukli do that I mean like that's the cause that's the name diabetes.
Okay. All right. Diabetes are types. So the earlier, do we have different types
Oh
of
yeah.
diabetes?
Yes, we do. I mean, Fafa, you can answer that.
There are a lot different kinds of diabetes. There is type 1 diabetes. Type 1 is actually an autoimmune disease. Your own body tissues try to fight whatever you have. That one is but it's there. And then the most common one everybody knows, diabetes, any type 2 diabetes. That is what Sister Ninette just explained. But no so clear, and you are not able to excrete it through your urine. That is what Sister Ninette just explained. And then the other one, which Sister Ninette is an expert of, is the gestational diabetes. That comes about when you are pregnant, and it's a whole lot of things happen, and then you do your test, sugar test, and they tell you you have diabetes whilst pregnant, and that can lead to type 2 diabetes in the future. And then we have one that is pre-diabetes, which is becoming common lately as well, especially in the young adults, and that also leads to type 2 diabetes in the future.
Okay. That type 1 and type 2 are which is which? Like I can't
Oh,
Oh, which
okay.
one
I'll add to that. Yeah. So actually, type 1 are very dangerous than type 2. Type 2 is preventable. Type 2 because of some things that we are doing that we shouldn't be doing. And if we watch it, abele sister ameponu first tag blower. Na belemna do queue. Yeah, and I know like lifestyle, doctor go check now out. So annual new alone do queue. But you really know what your body needs and wants, and you do it for it. Then you prevent type 2 diabetes. Onu duduma when they share them. Kaka type 1 sister Fafa glebe. And your autoimmune. Autoimmune means your own body is eating yourself up. O body doom abele amado stress play dolam nanova jonako. O body change behavior, just like cancer will do to you. O body mana cells change. Diabetes type 1 this is what happens. It journal video a journal school age and that one there's no way will new pancreas ye wana amachi na tuguna sugar digest na sugar no carbohydrate no I change happy me azan happy body aton azen na have type 1 when insulin the krama dotomo alore dotomo so little bana yala mato anu agbebe edu eliku ndudu abadu ebli ewonu klitomaola. That means your body is just gonna be stuffed with it. My fiada cry you go, my change you go. Type 1 are very dangerous. Yeah, immediately normal diagnosis. Atwa agblenu seriously. That might have control over it too. You don't have control over type 1. No. Like a type 2 yala, you have a lot of control over it. So difference na have type 1 ya jaba na dobui. Afi na dunu na dobui na dunu for na no sugar check mu amado do na pump. Ano glom na sugar ijila jaba na hwamachi. So you don't have any reserve to do your own thing. Type 1, I mean, it's a different ball game. Your life is all around insulin, medications, pumps, and stuff like that. Then the via 6 months, you put the ma, and you have the via pack, but as you control. I think I need to do a Jabana Dobby, little Mokata. That is the one that the $2 may never. I don't have one to body quiver, a job.
Wow. Okay. So I was going to ask when look at course in diabetes. Okay, I mean, don't have like is it hereditary? Like L family, I mean.
Yeah. For type 2, yes, it is. Type 1 there, and my start genetically, you don't have any control over it. It just happens. But type 2, yes, one of the causes is hereditary, and then lifestyle changes, like if you're not taking care of yourself, genetically now, and also smoking also causes it.
Okay. That if you diabetes, how is the person going to know? So what are the signs and symptoms? Oh, maybe it will click there. No, I'm getting it or I have it.
So signs and symptoms, but Amadolia, the never realize but na do dom subo all the time. Etikona no womb wule na lecha. Etikwa no womb very seriously. Jaman na no chinum na do don't have them, and I don't have lia a moava no trom na madunua. I feel bad about signs of about sugar masubo de la mano ha atwajo. I feel no sugar too much ha nkuma no trom Adolia mano no pomunyo our maybe a choco wo mokata na cho alo. I mean you know banana food them na ye ekpe amado ha akpoba gain weight a lolo about that me fine, you know, like you are big, you are not controlling your weight. So those are the lifestyle ones. So that won't turn akpoba you put on matro ever nyama lolo when you were very skinny before. Mokatala enyana sign but no totrom lenchio. Ma one exercise so maduna nunyo maduna gbenuo nu likupo nu jona jino nu toto. I mean no, you know, fried chicken, fries and more I mean no the chio amilama you ya milaji fine, you know. Those are the things that attract you. So those are some of it. Then you start to feel sick. Stuff of Fabia called the cockpia. Signs also.
Amadoma no door. If you no too clear subo door, they can smell. They have like that. They call it the fruity smell. If you have a sukli, the ketones, there's a lot of ketones. It has like that fruity smell. Yeah. No, if it happens to you, you know. Then you have a flower that will gonya. Yeah, that's how a lot of people describe it. Yeah.
Yeah. There might be is it also possible, Betty? I made them for all the symptoms so that we've mentioned. Okay, you still be pre-diabetic or diabetic.
Yes. Some people actually just come like Abalisan Blina. It's just like they've gained a lot of weight, right? So through Uncle the annual checkups, routine checkups we'll talk about some tests that is performed. That is when they know when you are diabetic. So it can happen. And sometimes too you just have like their nerves they don't feel their fingers. Okay, or they're having pins and needles. Those are some of the late stages, honestly, for you to have those things. Because the vessels, your blood vessels are dying. That is why you're not able to feel all those things.
Okay. Wow.
And the sugar also attacks your nerves. Never nerve, my like na sugar. But na pins and more for no tingling. You see, so those are late stages. Actually, they are more of the complications.
Advanced, yeah.
I cannot feel
Tafifia na doctor hospital. Vakpo doctor ne ogona be your pre-diabetic allo diabetes. What are some of the treatments, play medications, so that you be put on?
Okay, number one, I just no diagnosis, but Kaila. Number one, now blood work, na you annual test, a low back complaint, but yeah, Dr. Phil, but a new glum nalanaya, diabetes, a might develop nala, ta, Kajabaya, poverty, ta hemoglobin A1C, you wanna. Yenya test specific for diagnosing diabetes and maintaining diabetes. Ajaba na nyawo ogona A1C. You have to know your A1C. Tananya be doctor gboyobo wo A1C. Now ajaba doctor na your back. Aglona bo o level alenye icha about 5.9 6.0 ogona ba watch wo sugar watch wo ni tawa ba fi onu inawo ekwe a kaka fifia oga didi number to 5.7 tana wo number do 5.7 ka do le normal man ka fi ma o yoga ba pre-diabetes cha pre-diabetes o ma kwe wana do o ma feel ba dollar me you ka ke fifia o treat ma ba dollar mo na because amado le pre-diabetes o kono danada machiji no wa help no wa dollar. So fifia pre-diabetes is becoming me. Kakana let's see, is this 6.1 now, right? Up kukenya diabetes.
6, I believe it's like 6.4. 6.2. Yeah, 6.2.
Okay, oh, but in my field we're doing more or less because of the babies. Yeah, gestational dollar, they want it really low. Kaka over 8, hemoglobin A1C can go to 11 and up.
14.
It can go up really bad. Hamawa zikeda onona komama. Do the kwaja niko, you know, oko the kojia, opa sugar like over 500 meter grama twa a measure, you know. So that becomes a problem.
Okay. So just to piggyback on and Yadeglo from the beginning about the gestational diabetes yeah, is it just seasonal? But after nam before then it goes away. Hello, how does that work?
It's that is your
okay. So
expertise.
What happens is that you taina for fear my doctor pomola. There are a lot of things. Amadolia who have diabetes who kamadaka makashimu po manyao. O for fukova. No kwaba no nyama lolo alonuya Dr. Dolia all quick at it. Wa ben our tester ekbe ta no na wo lab test okata na one na full for tester okona hema kpene for your first lab test which is usually done between the time na for fully 12 weeks or 13 weeks now first trimester ekbe 4 man e de tepeton ekbe level 3 levels. The first trimester, fimayo o check na ovua. Nanyaba azala fimaba wo H1 hemoglobin A1C elejima as a diabetic. Kefiaba diabetes la ho ekpea. Kakana pass test ma kana do 28 weeks, which is the second trimester. Oga wana test lab test. Fimaya Meshi Fulala, they include that as normal test now. The Fimaya fee, so anything above 20 weeks, no diagnosis with diabetes, you are gestational. Like anything before, like in the first trimester, onyaba the quiver, just like about high blood pressure and the market. So with this one no way no voir avec more diabetes specialist in pregnancy. You want to do my first they try to do the food. So for 1 week or 2 weeks na didi wo na throw no duduma, you know, and eat more of vegetables, like proportion of food. No toto na dashila sugars as alone na minimize it. No soda na and all that. You polish your meal Akpobede within a week or so. No was sugar level. Now no was tom. You do the blood glucose by sticking your fingers 4 times a day. Now fasting. Now after breakfast, after lunch, after dinner. Tananya but numbers ma within 3 days. No kpoba is up. Then that means you're going to medicine straight. It can be the insulin or it can be the pill. So that's what we call diabetes, gestational diabetes. Nanyaba OGV for her, if you test for go now for diabetes itself. Nanyaba after 6 weeks, they will do the test. Nanyaba magaliola, then emin before quiver aga kweju. But FEMA is a sign, but now watch the queue because you have a tendency of becoming type 2.
Okay. All right. All right.
Just to elaborate on A1C.
Mhm.
A1C it's a blood work, but it's a blood work that determines your sugar level between 2 to 3 months at a time.
Okay.
Manyaba the doctor go with the then you go on diet this week. You go a doctor go check your sugar. I'm going to check my sugar. I'm going to be on a diet. No, it can still detect, but you are diabetic because it determines
Average is
yes,
the
the average
for 3
between
months.
2 to 3 months. Yes.
Okay. So if you are the name your wellness check, we have to make sure that this test, Nami A1C, right?
Yes.
Okay. All right.
Mhm.
Okay. So now if you are not a doctor or your hospital or the doctor, but now you have it. What are some of the after being diagnosed, what happened?
So it depends on what you were diagnosed with, whether it's pre-diabetes or it's type 2 diabetes. Then your pre-diabetes, the first thing they do is tell you to go on a diet, lifestyle changes. Na
That is funny.
Exactly. Yes. So yeah. Then they'll tell you to cut down on it. Then if you're obese, they'll tell you to start exercising. And then to clarify also, when you lolo have diabetes, okay. And Amadolia, they weigh like 100 pounds, okay, 50 pounds of crowd, and they still have diabetes. That it's lifestyle changes. It means there are things you do that you don't have to do anymore. It can be exercise, it can be drinking, it can be smoking, especially. That they'll tell you to cut down on all those things, and then you come back within 3 months. After 3 months, of course, they are going to check your A1C again. After 3 months, na kobo adidi alo age ha. Ta na drafma ye over na guy over A1C age. Then they'll put you on medication. That the medication they put you on, which means, but at this point, you've advanced to type 2 diabetes. That for type 2 diabetes, the first line of medication in your metformin. That is the first medication they put you on. Just a small dose to see if it's going to work. Nagava within 3 months, allo 6 months, you got check Oga EGA. They'll either increase the dose, allo depending on your numbers and depending on your sugar level, they will add maybe another medication to it. Okay. And one of the medications is the Ozempic. Now, one of the good thing about Ozempic, it helps you to lose weight, but it is meant for diabetes. That they'll put you on that is a weekly injection, and you'll still be on the metformin, or you just be on another diabetes medication. There are a lot of them. There is Jardiance, there is Junivia, there are a lot. Or they can put you on a combination medication, Oh, when I metformin, clojadians are together, so you are not struggling with it. And then I got you can it's not working now. They will start you on short acting or short acting insulin. They call it short acting because it works. It's rapid. It works very rapid. Insulin actually, it works very fast. That is what a lot of people are are familiar with. Not Dobiaqua, it works right away to reduce the sugar, and then you have to eat and all those things. And then there's another one that is called short acting. That is also works in a very short period. Okay, but it has a little longer life than the rapid acting. And then there's another one that is called regular insulin, which is depending on your condition, depending on the situation. So they go through all this just to make sure that you are getting the right amount of insulin or treatment that you need. Another one is Lantus. That one is long acting. Amaro Doni once a day, and it lasts for like 24 hours, just to regulate your insulin, your sugar.
Wow.
So,
I
bet, with the type 1, they use a lot of the rapid insulin because it has to start dissolving, like being used to reduce the sugar in their blood. And then when you are pregnant or when you eat immediately, na check about 1 hour, about pregnant, they are more strict with pregnancy numbers. So na have type 2 by yourself. I feel like they are more lenient when you are type 2, like the endocrinologist, or not too lenient sometimes, but they end up with complications. Whereas when you are pregnant, so some endocrinologists don't want to treat pregnant women with diabetes, so because but the diet is strict, everything is strict. They want the sugars to be the lowest. Now I got fat the VL. So because of that, you have type 2 in endocrine, but no for further enough now because they cannot control their sugar enough. I can have type 1 na no do get na do na do no for after a while, like an hour. I check where sugar, then you use the rapid to control it. Then you are probably taking the long acting for all the midday snack and all that. I feel Zama, I take long acting. No snack, so they use it with the pregnancy also the same as they do with type 2. And some people are on metformin, they don't want to stop using it. They will add a little bit of the rapid acting to control it during the day, but you're still taking metformin in the morning and at night. So it's complex. The management is between you and your doctor, with whoever is going on with you. Kaya hotel towards your own, doctor domain, the detail. Hey, Guamila is just oversight for you to know what can happen. Like where. So, yeah,
let me just elaborate on how metformin works.
Okay.
Metformin it works various ways. The kind it reduces the sugar absorption from food. And the other one is it helps the body to use insulin better. So you may have the insulin, but the body is not using it the way it's supposed to be used. The metformin is a miracle medication. It helps the body to use the insulin better. The other way metformin works is it stops the liver from making too much sugar in the body. So those are the ways. So all the medication work in different ways.
Okay.
Yes.
And metformin, go ahead. Yeah.
Metformin, which is the most common one, these are the common ways that it works in the body.
And they use it also for, we did not mention insulin resistance diabetes. Yes. So we did not mention that because it's a little more complex. That some people that develop pre-diabetes, they are more of the type that is their body, the cells are now reacting to insulin the way it should do. That they've been using metformin to kind of help the body absorb it and stop producing too much sugar and all the 3 things that Sister Fafa just said. So that's where they started treating pre-diabetes, but because now they are focusing more on the insulin-resistant diabetes, that they want to kill that kind of behavior of our bodies, so they are using metformin more. And it's also one of the cheapest medications if you're treating diabetes. Yeah, they have other types of medicines, but metformin is becoming very, yeah, but they all, they are medicine. So lifestyle change is the best.
Right. They can't have your advert on the TV Jigweshagba. Invokana. I'm over your dinaku. Invokana works like Jardiance. Jardiance is another old medication too that is used. So Invokana works in a way, Bernade, it secretes the sugar from the urine. So that is how people
lose the weight.
We'll just put it as simple as that. That is how people lose the weight.
After system amako, achika bana dogo, like it just tells it where to go. So you don't really absorb what you are eating. So it's like you're fooling your body by taking that medicine.
Exactly.
So whoever is comparing their eating to you will not get the same meal. I won't blame you, but
okay.
Yeah, that is the simplest way to explain it. Yeah.
You don't watch what people are doing, you don't copy what people
are
doing.
You never know.
The medication they are taking,
You don't know what they do in the closet.
I take medication.
You never know.
Yeah, you never know.
When you get on medication, when you're put on medication, is it for the rest of your life?
I would say yes and no.
Yes.
No, Bernade, yes. No, Bernade. When you start taking medications, it doesn't mean say it doesn't mean that you can stop the lifestyle changes because you have medications, right? So you're going to continue with healthy lifestyle and at the same time be taking the medication. I've seen people chika G, and then they control their lifestyle. The next time they go to their doctors, it's like A1C is very little, too low, which means what they've done great. So what's the point on being on medication? So they take them off and then tell them to continue with their lifestyle changes.
Okay.
You continue for the rest of your life.
And
there are some people who are just resistant. No matter what they do, they are just resistant. They can change their lifestyle, they can be on medications, compliant with their medications. But the next time they go out, it's rather worse than before. So when you become that complicated case, you are definitely seeing an endocrinologist for them to manage you properly. Yeah.
And with the diabetes going away or not going away, I've seen a lot of people that were diagnosed and then the lifestyle changes really, really relieve them because we have what we call, I'm a Google the a plate, like the plate that how your plate should look when you are eating. So half of the plate should be vegetables and fruits, and a quarter should be your your carbohydrates and meat. So if you can be looking at your plate and be like half of it is fatrically near fruits in a dua, and then the rest is half. You cannot have like a big bowl of fufu, and then some scattered meat and soup. Because abele mi do nanu la pecha. Ejaba meshia manetro no. Me have abe ademekli, fetri, kli, spinach, kli numokatala. You should be eating half of your plate that. And then the meat is quarter, and then carbohydrate is quarter. I think sometimes so the comia biaba amashia mana reduce the share the VVV instead of overeating one over the other. Just reduce the amount you eat. Then no reduce the do too much. Now reduce the carbohydrate. Now do too much of it. A little sweeter. The corona you don't feel good. That's why they call it lifestyle changes. Because once you change it, you feel better.
But that time that when I dish my food, half of it should be the vegetables, and the fruits or whatever. And the quarter will be the proteins, and the quarter will be the carbs. Okay.
Yeah. That's
it's easier to digest.
You remember.
Remember, yeah. A big bowl of fufu kore. Alale meza ko play soup kore. We are not do ko ano you do. Dolele ko akwenami. Okay, at this point, I take short commercial break. Then let me provide some questions. We'll take the questions and then we'll finish with the other. We'll finish up. Okay. Please don't go anywhere.
Oh, Finemia guy, FPF for me lelo. Robenya feel jojo. Jajradona Siana 2025. Ya for me le rehearsal so there le jajado. Mile, me ya fide for mile.
Oh, Nyakefia. You must be in my register at Dallas 2025. Because that's the only way my tongue get access to their hotel. I can't really worry. No, you may register this year. Can I never job? Hey, my tongue at the convention or would they refund my money to me?
What for now? Never and Hagana registration. I've another two more down my temple convention. The Canaswa. We are cool 11 hours when you now your convention organizers. Don't I not know my other than what to pay back for now. 11 hours, your fee, August 2025. Now do about don't hold back out Katan.
Nyatepa.
Nyatepa Nyakwemion. Bekwe Pepe Pepete Yakwemi date here August 13, 2025. Nonya Yoko wa cancel hotel reservations Aqua Agana.
You know what? You're too early to register for the convention now. The convention is update in August 2025.
Oh, phone and registration. Ekpanade Siana Movena would do near as an outie. Ohana Apo Hotel Penny Fede and
oh, Akpenade will pay them. We need to register. Mawe Kaba, Mayan Ovinji Gomita, Apato Guipe, Kolobadi. What no register, Namia Faza, Elevated.
For a home over Colo, Yami, Yama when me yom ya befu when to when me register me a fadala. Azalo.
Never ever throw a roller. Mega number. Davide, yo kujie. Never ever throw a roller. Mega number.
Yo, Miawezo. You're watching the Health and Wellness Tablet, Yana TV Play, Radio, Dile, YouTube, Nyako channel. Okay, so if you're watching, please subscribe and share. Egbe, we are talking about diabetes. Nemelen wo cry onyamede amede huole, and you can share and then gain some knowledge and share with people. Before then, let me just go over the programs on Siana Media Channel, YouTube. Fridays, Amia Tomia Novi, DJ Lawrence comes our way with African jazz and traditional music panorama. Fridays, 8 p.m. Eastern Time or 7 p.m. Central Standard Time. After that, today, Saturday, Kode, Miacha Mileji Health and Wellness Hub, 9:30 CST or 10:30 Eastern Time. Mileji, Milenusro about Miracle Health. Miracle Health. Remember, your health is your wealth. Name Meledokuoji Po, if we are not taking good care of ourselves today, Mark Po, the good health, Ako Woga, Alo Awo, Ayi Dome, Awoga, Ako Pomia Dokuji, and help others. So, Medokuku, let's take it very serious. Let's get more knowledge and then practice it. After that, Siena Central comes our way. Echo Steve, Claire, and Press Mausi, Alo Mama Seduji, they come our way with Siena Central Talk Show. So right after Miapo Show, please don't go anywhere. Stay tuned and they'll be on your way live from the same channel. And then after that, we have Dunenyo Bobobo, Miada, Mama MFA, all the way from Ghana in collaboration with Top Radio. You're trying to come away with Dunenyo Bobobo Show. So please stay tuned. And then after that, Miss Novergbe, Dr. Wanyo, Davina, me, Da Vero, Clay, Attorney Cyrus, Da Enyo, Dr. Dogbe, Wosubolo, Fimi, yeah, they also come and then they talk to us or they teach us about Elemia, Astromia dialect of there. This afternoon they will be on. Okay, so that will be all for Saturday. And then Saturday, Sunday, at your Sunday, Mia Damia Novi, David Nicole, or comes away with Afrikuchu. Yonha Ovana, Overgrown, or Misroano, about Miapo de Kono, a lot of stuff about our culture. We have a lot of programs lined up on Siena Radio and TV channel on YouTube. Minomokbo, keep watching. We our brother and our secretary for Siena and for Patrick Ajadu is also coming our way sometime. I don't know, maybe sometime this year. But Siena World View. So we are looking forward to watching that as well. That's about it for the shows on our channel for now. And please keep watching our channel. Even as I said, subscribe and share. Please subscribe and share. Subscribe and share. So now we go on to our questions to our viewers, from our viewers in the studio. No, our viewers watching us online. So Lifetime Legacy says, great job. I have a problem. Anytime I eat something that contains sugar, and when I use the restroom, it comes with blood. What should I do? I am a man.
It comes with blood.
Anytime he eats anything with sugar, anything that contains sugar, yeah.
It can be a lot of things.
Yes.
It can be a lot of things happening. It can just be, but he's dehydrated. That would be the least thing I can say. It can just be, but he's dehydrated. Okay. It can be, it may not have, it can be, but it doesn't have anything to do with the sugar. It can be, he's a man, as he said. So I think the best thing to do is to go to your provider, your doctor, I don't know how old is he, but he can go. Prostate is one thing that he needs to look at as well. You don't have to be feeling a pain to nobody. You have a prostate issue. Those are some of the things that I think he should work on. The best thing is to go and see a doctor. Yeah.
And I can also add that anytime, let's say, some people, when they eat sugar, they have like diarrhea. If you're going too much, and it may be gastritis, it may just erode some of the mucous membrane. You may see pure red blood. And then if you are constipated and the sugar makes you go, it's going to actually scratch the inside of your rectum and all that. And if you have hemorrhoids, that can also be a part of it. And maybe that sugar is actually making you go, because I'm a non juice, plitola, I bet the view no for the mono now juice, apple juice and stuff like that. They go more than they would normally. So then we are thinking of colon. you have polyps.
Did he
have
say
something
when you
going-
urinate or?
No,
No,
when
he
you
didn't specify.
you go
Oh,
to
he
the
didn't
bathroom.
specify.
So we're not
Okay,
sure
bathroom.
So it could be
Okay,
anything. Yeah.
all right.
we didn't specify. So if it's the number 2, then that means but there's something in there that is bleeding. It can just be common hemorrhoids. The veins are too, when you have a lot of constipation, you don't go on time, you may develop that. And if it's not that, if it's over 40, he has to go for colonoscopy.
As well.
Talk
Yeah.
to his doctor, have a plan. But the prostate because we don't specifically know if it's the urine.
A
If
urine,
you're
yeah.
urinating
Yeah,
and there is blood in it, it can be urinary tract infection, it can be prostate, it can be anything, kidney
Dehydration,
disease,
yeah.
anything. So that needs to be looked at. Nobody should be having blood in their urine or in their feces.
Okay.
So anytime you see red, you should go. If you see black, it means the bleeding is coming from up, and coming down. So bleeding, black stools, when you did not eat anything black, you should check with your doctor immediately.
Okay. All right. So for lifetime legacy, please go see your doctor immediately. Please. All right. Hey, because it's a lot of stuff. That's a lot of stuff that you.
It's
very urgent.
No, but as it's not, it's not like an emergency.
room.
But I want an emergency room 4 hours. So, ow.
The next
Just
week,
book
the
your
next 2
appointment.
weeks, yeah.
All right. And we also have Grant Ayayi says, what are the common symptoms of diabetes? I think you mentioned it earlier, but probably he came later on that. If we can just go through it quickly for him.
Yeah. So we said too much urination, too much thirst. When you feel like drinking water all the time, you're not fulfilled. When you drink a bucket of water, you're still wanting to drink. You keep peeing. There's sugar in your urine. You feel tired, blurred vision, a whole lot of different things. Tingling in your hands, tingling in your feet. That's advanced. Advanced is when you start to feel physical stuff. But the blurred vision, when it goes up, you may not see well. When you get up, you feel really cloudy. You don't feel good. The not feeling good part is when some people really notice, but they feel like, oh, I'm gaining weight. That's why, but you shouldn't be knowing the why. You have to go to your doctor to check the why things are happening. And then the fruity smell to your urine. You go and pee and the room smell like fruits. Fruit there, the scent comes out. So when you smell that, your sweet smell of your urine shouldn't be you. That means too much either sugar or ketones. So you have to go see your doctor. Yeah.
Okay.
And then we forgot about one. What did we learn in nursing school? The 3 what? There are 3. You mentioned 2. There's one more. Too much eating, excessive eating.
There's the D's. The
3 D's, right?
The 3 D's.
Dysphagia.
Like you want to drink more, you want to pee more, and I think is it
you
hunger?
eat more. You eat more. You eat more.
There were
yes.
3 things. The 3
things.
D's.
Yeah, the
3
thirst,
Ds.
peeing more, I think, and then eating more. Those are the 3. The gold standard that they used to. I don't know if they still use it. I don't see it in any of them.
I'm sure they still use it because I remember one of my instructors told me when she went to the village. You know how people pee outside in Ghana, right? They pee on the ground. When you pee on the ground, then
yes.
The urine sits there. It doesn't absorb like water, So she complained to her daughter, and the daughter was our instructor. So she said when her mom peed, she just tasted it, and it was like sugar syrup.
Wow.
And that's how she diagnosed her mom from the village straight to Accra for treatment. So that's, so your own urine, you can taste it. It's your own urine. Don't go about tasting other people, but she tasted her mom, thinking that, but that's her mom, and she's old, so she's not going out to get any disease for her. But your own self, if things like that are happening, it will not be bad to know that your urine is sweet. Urine should be salty and not sugary.
Oh, wow.
Your urine should be full of salt.
Wow.
Yeah. So
Yeah.
me kwe ko ba le couple man. Yeah, have doctor. Me ina doctor go easily. Unless
Yeah.
a let dove you mo na na fiade ko wa. The best thing to do is now I do dodoma dove you a cap man and I do it. It's your own urine. It's not gonna kill you.
Okay.
Then I let's say you don't want to swallow it, but like
No, it's not contaminated.
It's not
like
contaminated.
no, it's not.
Yeah, I hear, but I made up. Some people even drink their own urine.
Yeah. So it should be.
That's a whole different thing.
Yeah.
Sugar. No, sugar level. That means you're having too much, so your kidney wants to get rid of it.
Okay.
That's one of the ways now doctor. But if I do not with him, the doctor will know what you're talking about.
Okay. Wow. Okay. So we can test our own urine just to make sure how
if you are in the village.
That's like an old school way of checking. Yeah.
Okay. All right. So another question had for CFAS, but Frank CFAS Adaji. So what is the side effect of metformin?
Metformin.
Metformin, yeah.
Yeah. Most medications affect the kidneys. Okay. So that's one of the signs you can look at for. And then metformin also in the hospital. Okay, when you go to the hospital for metformin, they'll stop it. They'll stop you from taking metformin just because if you have to get a contrast, okay, if you have to go do a test and you have to get it affects it. It affects it, so they stop you from taking metformin. But mostly it's also part of it affects the kidneys as well.
And the first and foremost things for all the diabetic drugs is low blood sugar.
That's right.
You feel like you go into the negative, let's put it that way, that your sugar becomes so low that you may collapse, So you feel thirst, you feel like eating, like you're really shaky. Those are side effects for all medications for glucose levels. And nausea, GI stuff, gassy, you may feel shortness of breath. When you start to feel shortness of breath or muscle pain, that is really a serious side effect. You have to talk to your doctor. Dizziness because your sugar is low. That's also one of the symptoms. Sometimes you may feel headaches because your sugar has been high and now you're trying to bring it to be normal. It will give you headache. So, but when you feel weakness, muscle pain, like that's probably eating out your muscle. You have to let your doctor know. And then if you feel like you have to collapse, that kind of thing, you have to always let your doctor know.
Okay. I think one other common one also is excessive thirst.
Yes.
Because you are secreting it, it's you get dehydrated a lot. So just make sure you drink
and you may have rash, which is for all medication, most medications, you get the hives or some rash and tiredness because you used to run on high glucose, right? And then you're reducing it to give you some tiredness and some weakness. And some people may get the gas with diarrhea or, like your stuff will change. And some people, some of the things will go away. And then, so the little GI stuff, you can deal with it, take some Tums. And the rest of the things, if you are having nausea, vomiting, if you're on any medication, nausea, vomiting, and muscle pain, and all the stuff that are really bad, you have to let your doctor know immediately. You may be allergic to it. You do not know. So you have to report it back to whoever wrote it for you.
Okay. All right. Thank you all so much. Akpanami, all too soon. Our time is up. The last comment I see from, that's from my sister, this girl at the boys Spriggs from She's watching us all the way from UK. She says, "Good job."
Wow, that's
See that?
nice.
So yeah, thank you, sis. All right, and thank you to our
Before
viewers.
before Miss Dell, before we leave,
Oh, we're not
let me.
leaving now. I'm just going to give
Oh,
you
okay.
the time to give us your final
Okay.
message about diabetes, what we should do, what we shouldn't do, what to look out for. Then we wrap up. So let's wrap up. Please go ahead.
All right. Before we even get to that, I just want to say, but there are some medications. No, even though you have diabetes and you're being treated, if you're on some medications like heart medications for your heart, antidepressants, some of those medications, antibiotics, they can actually cause you to have more sugar in your blood. When you have when you're on other medications and you're about to be put on diabetes medication, you need to have your doctor know the kind of medications you are taking, because you can be getting treatment for diabetes. Meanwhile, it's not going anywhere because your other medications are not helping you. So just make sure you tell your doctor what medications you are on, so they know how they can treat you.
Okay. Very important because of the drug interactions, right?
Yeah. And anytime you are sick, your glucose levels go really up. So sickness can really be the very hard time to control your sugars. But once you get better, it also moves down. So just for them to know. Yeah.
And if you are diabetic, you are prone to having infections.
Yes.
Lots of infections, just because of the sugar level. And I think we forgot about something.
The food.
So the long term, yes. If you've been diabetes for a very long time, you end up some of your risk is you end up with heart diseases, you end up with stroke, okay, and then you end up with a lot of infections, and then you also end up with nerve damage. Okay, I think we've been talking about nerve damage throughout, but this is a serious one because you've been living with diabetes for a long time. The stroke occurs because your nerves are damaged, right? Your nerves going through your heart is damaged. So what that is a whole topic we can talk about. But if your nerves are damaged, it means that the blood is just flowing anyhow, right? So if it dislodges somewhere in your brain, you get a stroke. Okay. And then the other thing is, if you have nerve damage, let's say it happens in your extremities, your fingers and your legs, they will be dead. Okay, they are going to be dead. Now, especially that happens on the foot. Okay, and then you'll be wearing your shoes, you'll be going about your business without knowing what is happening. One day you realize, but some people don't even detect it until it becomes worse, and then all the smell is like none of them no the socks here. Meanwhile, you are taking it's a very serious thing. It happens. Kakawakpo is like a big wound. It can be a big wound underneath their feet, but they don't know because the nerves are damaged. Tanado, most of them end up getting amputation because the nerve in that area is not working, that they get amputation. So what primary care providers actually do is when you go to your annual visits, and of course they know you are pre-diabetic or normal way, let them do it. Okay. I believe this is an educational thing, and normal way, let them know, but they have to perform. You have to perform a food care yourself as a diabetic or a pre-diabetic. You need to make sure, but you are checking the whole skin, the whole body. Now, make sure you get treatment because it gets worse. Okay, because your nerves are not working right. So make sure you are checking your food. You are doing a food exam yourself as well. And then when you go to the hospital or the doctors and they don't do it, remind them. Just remind them to do it. The last time we were here, we talked about our African community just going to sit at the doctor's office. Whenever we come on this show, we are going to talk about it. They go to their doctors and they just sit there for the doctors to do whatever they want to do, and they get up and go.
Yeah.
Unless the doctor is their friend, they are not able to communicate.
Maybe a question.
So that should stop. A lot of people illiteracy is going away because of internet. So you can learn a lot on the internet. Before you go to your doctors, make sure you make yourself aware. Make yourself aware of your body, your situation. I think I draft Magoji. Ali never know onyada glomo. Ask the question, or if you contradict what you know, ask for clarification. I'm not saying Dr. Google is always right. No. But make sure you do have your questions. And then make sure you ask those questions. Talk to them. Talk to them because they are there for your health. Open up to your doctors. There's HIPAA law. They cannot take those things anywhere. Even if it's your child, he or she is not allowed to take your medical history anyway. Talk to them. Let them understand how you feel so they can individualize your care and manage you very well.
Yeah. So the complications of diabetes are stuff of fat blood fear. Amadolia, they don't even have all the symptoms we talked about. The foot abila for diagnosis for diabetes are donagoi. And that means it's been with you for a long time. The rashes, open, especially the perineal groin area, nuna no them abina no warm, manya fee, like it's not going away. The pimples cry joda mama jo azunu gade. So you have to check all that out. Like complications of diabetes are in your kidney disease, high blood pressure, and the high blood pressure also lead to stroke and the amputation. It may give you the guys, they may not be able to perform because of the diabetes itself or the medications side effects. So everything that you're doing and you think the medicine is the go-to, it's not always the best. You have to only use it when you have no control. Diabetes can go away if you have type 2. No law, no trial. I mean, those who are newly diagnosed especially, no change upper weights, no check upper glucose every day. No one known to do the upper glucose level. No probably the diabetes, the hemoglobin A1C, to the normal range. I've done it with my friends. I've done it with so many people who did not know that they have diabetes. So once you know what you are putting in, you have to stop eating sugar. Like, I'm not saying don't eat a little bit of your own birthday cake, but then your cake use it to subsidize whatever. Let's
use
say
it to subsidize the action.
Sandwich sugar. There's still a bread that una do a cake. That makes up for what, So when you're dieting, you can exchange. We call it the exchange. So then you buy a Viper birthday. Cake. Yes, but don't get the icing on it and all that. The cake is the main thing. So eat the cake and leave the icing. Be very picky on your plate. Eat like a king or a queen instead of eating like a farmer. You know what I mean? A farmer may even eat the freshest of everything, but don't eat like a city girl or a city boy, right? Where you only get the fried foods. Prepare your food ahead of time if you have diabetes, because let me describe the wound now so fast because the sugar drops, right? The man to draw one that I need prepare that for breakfast, lunch, dinner, close snacks in between definitely you're gonna reach out for the cookie and the bread. They are the fastest. You're not available. The plastic makodri. So be mindful when you have diabetes. Cook food down. Put them in little containers. like as if you are really dieting to lose weight, but you are actually planning your meal ahead of time. So hama committee bamia agbede mi agbo na asiama na nwanyi the unsema like so we can meet here. Yes.
Thank you so much. That's so much information.
And with Sister Ninette mentioned kidney disease. Diabetes and kidney disease. We all know where that leads to.
Yeah.
At the end, when your kidneys are damaged, then it means you are going on. Exactly. There's nothing else. Yeah, kidneys are damaged. You are going on dialysis. That is it.
And you know what? Too. When you have the diabetes, or annual, you are your primary doctor. The deolo. Ejaba na ve cardiologist. Na kidney doctor. Na eye doctor.
Endocrinologist.
Ophthalmologist, not the eyeglass doctor. Ophthalmologist. Yeah, dilate just like you do for any other, like high blood pressure. You have to have special doctors that sees you. Podiatrist for your foot, you know, so you don't have to be cutting your own nail. Now you what trimmer for not hard calluses on your feet. They'll clean it all up, and then you know. So you have to have all specialty doctors looking at you. Once a while, I thought a kidney doctor. So they'll do if your doctor is not doing the kidney function test now. Because once you have specific diagnosis, your blood work is different from anybody else.
Okay.
So once it's also that's why we are playing. But I'm a shama the diabetes machiada. You can have diabetes, can be a former diabetic, or you are still diabetic on no medication. You can be that, and you live a very healthy life. Because I've also seen someone she was actually a healthcare practitioner. She thought she can do like manipulate medication, so she'll give herself insulin, give herself. She did that till it became a disease for her. Because of overusage of insulin, because she was trying to be too smart. So you can hurt yourself trying to do shortcuts. Do the long way is better and healthier. And lose weight slowly now through some magic stuff. Rapid
results.
Rapid results will give you rapid failure. So just try, or unless you can maintain the rapid result, that's a good thing. If you cannot maintain it naturally, then it's a bad thing. So diabetes is deep. It's a lot more to it. There is the diabetes diabetes association. If you Google diabetes, you're going to read a lot there. We can't give you all the information. Now NIH, you can get, CDC, they have the topic diabetes there. Every disease forum, I don't know which ones are in UK and all over the world, but every country has their own. I was looking at
the World Health Organization is everywhere.
Yeah,
it's a common place.
Like you just go into it and say diabetes. It will give you information, the science, everything is there. So then you educate yourself before you go to your doctor, like Sister Fafa said, right? And that helps you. And the doctor knows you are knowledgeable. They will not fool with you. They will not run to the room. You have to be knowledgeable with your own condition and tell the doctor, you have to listen to me. I'm the one suffering from it. You have to listen to me because I'm telling you what is wrong with me. And before you treat me, you have to listen to me. If you don't listen to me, how are you going to treat me? So it comes to that. You are paying him, he has to do your work,
Worldwide, diabetes is affecting about 820 million people. Worldwide. As of now. It's more. Yeah, but that is what we have right now.
Into another show start. I have two more comments here. Ravi Jemima question says, "Great job, ladies. Very educated." Ravi Eunice Akotoha, very educated. Thanks for including some Ewe language. Please host one fully in Ewa so we can share with
They'll be
relatives.
lost.
Ewa.
They'll be
That's
lost.
gonna be another hassle. The Ewa
They'll be
language.
lost.
But we'll
You have
try.
to
We're
make up
trying.
the language.
We will
blend
get
it.
there eventually.
Yeah, we're trying to blend
Yeah.
it. W unit star. Vida komi for me. Thank you all so much. Also, our time is so maybe next time we just have to had part 1 and part 2.
Yeah.
That's what was gonna help us.
Yes, I think
The 1
yeah,
hour
I
is
think so.
never enough.
Mm-mm.
So
No.
next time we'll do part 1, part 2, so we can digest everything on the topic.
Or maybe we'll come
Thank you
back
all
and
so
just
much.
continue later.
Yes, we
Yeah.
can do that as well. We can do that.
Yes.
Thank you all so much. Thank you, Sienna
Thank
Nurses,
Akpe.
for lending us these beautiful ladies, Abby Fafa and Madam Ninette Akpenami. Thank you all so much. You're always willing to come and educate us on our health. Akpenami, this has been a health and wellness show. We've eaten into the time of FO Stephen and Press Multi. Please forgive us.
For Steve, we
We pay
understand.
him back. Yeah.
And please remember, Sienna 2025, Egbona, Sienna 2025. If you haven't registered, please go ahead and register. If you're not able to come, you can always cancel, and then your money will be refunded to you. I'm going to say I'm near register. Let me do agbe. Let me contribute. Let me cover our projects back home. Until we come your way again next Saturday, stay healthy and know that your health is your wealth. Thank you. Bye-bye.
Thank you. Thank
you.
you, everybody.
Bye.
Bye.